Oh. Do you have a stiff neck? Try these stretches at home. Hey everyone, it's Dr. Andrew. Today we're going to talk about neck stiffness and neck pain. In the last 2 years, a lot of jobs have gone over to Zoom, a lot of computer work, so a lot of people are hunched over and they have the forward head posture and just tons of neck stiffness. Okay, so today we're going to talk about how we can get rid of some of that neck stiffness and make your neck feel more mobile and more flexible. Now, first of all, let's look at the actual neck. Okay, this is the base of the skull. The cervical vertebrae right here are the purple ones, and you have tons of muscles that attach right up in here, and then you have muscles also that attach down to you have the shoulder blade right in here, and then you have the clavicle. I wish they were here so you could see it, but work with me here. So you have the clavicle and the shoulder blade, okay? And now you have these muscles called the upper trapezius, which is this muscle here, okay? And then you have the levator scapula. The levator scapula, and I'll show a picture of this, attaches to the scapula and then attaches right up here into these transverse processes of the cervical vertebrae. So when these muscles are really tight and you have lots of tension from hunching, from leaning forward, a lot of that neck stiffness is going to come from these two muscles. So another thing that I need to say is that if you're having any kind of numbness or tingling down one arm or both arms, or if you're having like extreme pain with migraines, I would not try these. I would go see a doctor or go speak to a physical therapist first and then make sure that these exercises are appropriate for your case. So the first thing we're going to look at is some gentle movements of the neck. Okay, so Krista, what you're going to do first is you're going to bring your neck down and bring your chin down as far as you can. Okay? Just like...
No.
Yeah. Yes, now. It scared me.
I think you're gonna like tell me how to do it, and then I was gonna do it.
All right. No.
Okay.
Okay. So I'll do it. I'll do it, and then you can do it. So, with your mouth closed,
Yeah.
I want you to, and your shoulders tall. Okay.
Shoulders tall.
I want you to bring your chin down. All right. So now we're bending into flexion of the spine. Gentle range of motion. Hold that for about 10 seconds, and now I want you to go backwards. Okay. So look up, bring your neck back. There you go. About 10 to 15 seconds as well. Okay, and then go again. So we're going to repeat this from 5 to 10 times, going down and then going back up. This is called flexion and then extension. So now we're going to go into rotation. So Krista, you're going to take your chin and you're just going to rotate to the left. There you go. Hold, and then we'll hold that for anywhere from 5 to 10 seconds. And then let's go to the other side, rotate to the other side. You see how she's keeping her shoulders back. She's keeping her posture nice and tall. All the motion that she is doing is coming from the cervical spine. We're not getting any other kind of rotation from the thoracic spine or from the lumbar spine. Okay, so she's going to do that about 5 to 10 times for about 5 to 10 seconds. Okay, so now we're going to do side bending. This one's a little bit trickier, and this is where people try to compensate with their shoulders. So Krista, keeping your shoulders level, and you're not going to move your shoulders, I want you to bring your ear down towards this shoulder. There you go. She should feel a little bit of a stretch over here on this side. Okay, and now let's go to the other side. Okay, very good. You can see here we're getting some tension, some stretching here in these muscles. Okay, these are the scalene muscles. Your nerves, a lot of nerves go through the scalene muscles, so if you have a lot of tension and tightness right here, you could have some pain going down the arm. Okay, so that's side bending. So now what we're going to look at is called the chin tuck. This is a very common exercise that we do in PT that I've seen on YouTube, but a lot of people are just not doing it very properly, and they could actually exacerbate their symptoms. So with the chin tuck, what we're really looking at is to bring this part of the neck back some, okay? And the way we do that is we tilt the chin down, and then you're going to push backwards just like that right there. Now notice her body didn't move. She wasn't pushing backwards or really poking out the chest or squeezing the shoulder blades, or even what a lot of people do is they bring the back of the head and they bring it down like this. That's not what a chin tuck is. So do it again. Tuck your chin down and then you're pushing back and then relax. That is a proper chin tuck. That is going to stretch out joints, it's going to stretch out ligaments, and it's also going to help strengthen the lower cervical muscles. So with the chin tuck, it would be good to do about 30 repetitions of the chin tuck, and every time you do it, hold it for about 2 to 3 seconds. So the next thing we're going to do is an upper trapezius stretch, or the upper traps. Now the upper traps are right here, they attach on the scapula, and then they go up and they attach to the neck. Now when these muscles are tight, when they have trigger points in there, it's really good to stretch. You can also go to a PT and get some dry needling done, but if you just want to be at home and you want to stretch it, we're going to show you the proper way to do that. Now, since it attaches to the scapula, we have to make sure the scapula is staying stable as we move into the stretch, because if we move into the stretch and we don't keep the shoulder stable, then that shoulder can come up as we stretch, okay, just like that, and you're not really getting a good stretch. So what we want to do is make sure that the shoulder is staying stable as we go into a stretch. So Krista, you can either, well, the best way to do it is put your hand behind your back. So put this hand behind your back, okay? And now, with her arm locked in right here, as she moves her neck to the other side, so go ahead and move it to the other side, and then you can even take this hand, put it on your head, and then pull a little bit. As you pull and feel that stretch right through here, this arm locked in on your low back is going to make sure that the shoulder stays down. Does that feel okay? Mm-hmm. Is it stretching?
Yeah, feels good.
Okay. With these neck stretches, I like to do a little bit less time than normal, just because when people's heads are tilted for a long period of time, they can get a little bit dizzy. So with this one, 15 to 20 seconds. All right, very good, and that's the upper trap stretch. So the last stretch we're going to look at is called the levator scapula stretch. So again, the levator scapula is just that. It actually elevates and brings up your scapula. Now, if we are hunched, if we've got this forward head posture, then that levator muscle is going to be really tight and it could have knots. So again, you can get a PT to do some dry needling, some other stretches, but if you just want to do these here, awesome as well. So the way we're going to stretch this muscle is, if we want to stretch the right side, she's going to take her right hand and try to touch her shoulder blade. So now she's going to take her other hand, put it on top of her head, and she's going to pull her head down towards her opposite leg. Okay, so she's looking here at her left leg while she's stretching the right side of the right levator scapula. You feel that stretch? Mm-hmm. Okay. So again, 10 to 15 to 20 seconds, and then you can relax. Now let's show the other side. So you're holding here, hand here, and then you're pulling down to the opposite thigh, and you're kind of looking at your opposite hip. And then you feel that stretch right up through here. Again, a very important stretch to do. Make sure you have great form while you're doing this. Don't let the back curve, okay? You're just solely feeling that stretch right here in the neck. Okay, and that's the levator scapula stretch. Okay, so that's a great way to get rid of neck stiffness and neck tension. If you have any questions, please leave a comment and like and subscribe to my channel. Thank you so much.
And remember, life is sketchy
When you're not stretchy.